Okay, this video is going to demonstrate muscle energy for a typical cervical vertebrae. Our typical cervical vertebrae are C2 through C7. And the diagnosis for a typical cervical is always going to flex and be flexed or extended and then rotated and side bent in the same direction. So my patient here has a diagnosis at C5 of being flexed, rotated, side bent to the left. So since it's muscle energy, this is a direct technique. We are going to stack all of her planes into the barrier. And so I'm contacting my articular pillar of C5 down posteriorly on my patient's neck. And once I have a contact onto that articular pillar, I'm going to use my hands cradling her head to manipulate that joint. If she's flexed, I'm going to add some extension, and I'm primarily extending her by moving my two fingers, contacting the articular pillars anteriorly in reference to my patient. By moving my fingers bilaterally anteriorly, I extend the segment I'm concerned with, which is C5. Once I've added the extension, I'm going to rotate her to the right until I feel the motion at the C5, and then I'm going to side bend her right. And then as with all muscle energy techniques, I'm going to have my patient rotate against me. So go ahead and press into my thumb. That's resting on her cheekbone. And then relax. I'm going to wait that second, and then I'm going to re-engage the barrier in all three planes. And then I'm going to have her push into my thumb again. And relax. And as with all muscle energy, I'd repeat this 3 to 5 times or until there's no further change. I'd bring my patient back to neutral, and I'm going to reassess the motion in that joint.